Question 1. The implications of poor patient shielding in prolonged fluoroscopic procedures may not be immediately visible to staff. Consider the case of Ester Lawson, a 62-year-old patient undergoing a complex peripheral angioplasty lasting over 90 minutes. Despite the team following procedural protocols, staff forgot to use lead shielding over Ester Lawson's lower abdomen during most of the case. What is the most likely outcome associated with oversight, and how does this relate to ALARA principles? A. Ester Lawson's procedural success may be compromised due to increased scatter radiation. B. The omission is acceptable under time pressure since the case length was under 2 hours. C. Ester Lawson may suffer deterministic effects, such as skin injury due to prolonged radiation exposure. D. The lead shielding is more critical for staff safety and less important for patient outcomes. Answer. Correct answer. C. Ester Lawson may suffer deterministic effects such as skin injury due to prolonged radiation exposure. Explanation. Under the ALARA principle, as low as reasonably achievable, both staff and patient protection must be optimized. Prolonged fluoroscopic time increases patient dose significantly, and failure to shield sensitive areas, e.g., abdomen, reproductive organs, may result in deterministic effects such as erythema or skin necrosis, particularly if peak skin dose exceeds 2 GI. According to SERP Report No. 168, fluoroscopic procedures with high cumulative dose can lead to radiation-induced skin injuries. While shielding staff is crucial, patient protection is equally mandated under 21 CFR 1020.32 and ASRT technical standards. Therefore, option C is correct. Question 2. In terms of image acquisition, which of the following most accurately reflects how improper setting of exposure parameters affects digital subtraction angiography DSA quality? A. High KVP and low mass result in increased spatial resolution and better vessel delineation. B. Low KVP settings enhance contrast but may result in excessive noise and poor subtraction. C. Increasing exposure time during DSA reduces motion artifacts and improves diagnostic quality. D. Increasing pulse rate during fluoroscopy decreases radiation exposure and improves contrast detail. Answer. Correct answer. B. KVP settings enhance contrast but may result in excessive noise and poor subtraction. Explanation. In ESA, image quality is influenced by the KVP, MAR, pulse duration, and post-processing algorithms. Low KVP settings improve iodine contrast visibility due to increased photoelectric effect, but at the cost of increased noise, which can degrade subtracted images. According to ASRT G70 and ASRT digital image processing standards, excessive noise can impair vessel clarity and reduce diagnostic utility. Option B reflects the correct trade-off concept. Question 3. Considering the evidence, Mr. Abrahams, a 70-year-old with renal artery stenosis, is scheduled for an angiographic procedure. During the procedure, the technologist notices a malfunction in the flat panel detector system, leading to inconsistent brightness across the image. What is the most appropriate immediate action? A. Switch to image intensify mode to continue the procedure without delay. B. Adjust the brightness and contrast settings manually to improve the image. C. Notify the radiologist and initiate backup imaging protocols immediately. D. Continue the procedure and report the defect after completion. Answer. Correct answer. C. Notify the radiologist and initiate backup imaging protocols immediately. Explanation. In vascular interventional procedures, image quality is critical for accurate catheter navigation and diagnosis. Flat panel detectors must undergo quality control and calibration per DSA regulations and asset equipment maintenance guidelines. The brightness artifact can compromise patient safety. Continuing without app. Visualization risks iatrogenic injury. Option C aligns with best practice standards from ACA and ASRT, which mandate immediate corrective action or use of redundant systems. Question 4. From a practical standpoint, what is the safest and most effective method for monitoring cumulative dose during compartment ESAs? A. Estimating based on fluoroscopy time and number of ESA runs. B. Using a patient dose monitoring system integrated into the fluoroscopy unit. C. Visual inspection of skin changes post-procedure. D. Reviewing prior radiographic studies to assess baseline dose. Answer. Correct answer. B. Using a patient dose monitoring system integrated into the fluoroscopy unit. Explanation. Modern fluoroscopy systems are equipped with dose area product DAP meters and peak skin dose indicators. These are required by FDA regulations 21 CFR Part 1020 and help prevent deterministic injuries. Estimation is unreliable and visual inspection is reactive rather than preventive. Option B. Supports real-time monitoring and aligns with Joint Commission radiation safety mandates and the OPAM guidelines. Question 5. The growing trend in hybrid operating suites has introduced complex imaging systems. Which component in fluoroscopic imaging primarily improves contrast resolution and reduces noise, particularly in low-dose imaging? A. Collimator blades. B. Flat panel detector dynamic range. C. Pulse fluoroscopy generator. D. Anti-scatter grid. Answer. Correct answer. B. Flat panel detector dynamic range. Explanation. The dynamic range of a flat panel detector determines its ability to distinguish small differences in attenuation, essential for soft tissue contrast in vascular imaging. According to the IC 62220-1 standard and asset imaging physics section, broader dynamic range allows visualization across a spectrum of densities even at lower exposures, improving in quality while maintaining dose efficiency. Hence, option B is correct. Question 6. A critical examination of vascular access methods reveals that Ms. Tran, a 68-year-old with severe peripheral vascular disease, is scheduled for a low extremity angiogram. Given her poor femoral access history, what is the most appropriate alternate access site and guidance method to minimize complications? A. Radial access using palpation technique. B. Jugular access using blind puncture. C. Brachial access under ultrasound guidance. D. Popliteal access under fluoroscopic guidance. Answer. Correct answer. C. Brachial access under ultrasound guidance. Explanation. Brachial access offers a safe alternative in patients with difficult femoral access. However, complication rates e.g. hematoma, arterial injury can be high without ultrasound guidance. Guidelines and practice parameters recommend ultrasound to enhance safety, reduce puncture attempts, and prevent complications. Popliteal access has limited maneuverability, and radial access may be inadequate for lower extremity interventions. Question 7. Which of the following best describes the function and clinical value of the anti-scatter grid in angiographic imaging systems? A. It enhances image contrast by absorbing scattered radiation before it reaches the detector. B. It improves spatial resolution by narrowing the beam width. C. It reduces patient dose by filtering primary radiation. D. It increases detector sensitivity to improve signal-to-noise ratio. Answer. Correct answer A. Enhances image contrast by absorbing scattered radiation before it reaches the detector. Explanation. An anti-scatter grid is a physical device positioned before the detector that filters scattered radiation, which otherwise degrades contrast. According to OPAM Report 58 and ICUP 117, grids enhance contrast but can increase dose if not optimized. They do not improve resolution or reduce dose directly. Question 8. Given the circumstances, Mr. Owens is undergoing an endovascular procedure when he develops bradycardia and hypotension. The technologist recognizes the onset of a vasovagal reaction. What should be the first intervention step? A. Administer intravenous atropine. B. Apply cold compress and observe. C. Immediately elevate the patient's legs and monitor vitals. D. Notify the radiologist and continue the procedure. Answer. Correct answer. C. Immediately elevate the patient's legs and monitor vitals. Explanation. Vasovagal responses are managed first by supportive measures. Laying the patient flat, elevating legs to enhance venous return, and closely monitoring vitals. According to ACL's protocols and emergency management guidelines, pharmacologic interventions like atropine are reserved for persistent bradycardia. Early recognition and non-invasive correction are key. Question 9. During the process of angiographic injection, what is the primary safety feature of power injectors that prevents catheter rupture or patient injury? A. High pressure burst capability. B. Pre-programmed injection protocols. C. Pressure limiting mechanism with alarms. D. Rapid contrast heating and delivery. Answer. Correct answer. C. Pressure limiting mechanism with alarms. Explanation. Power injectors used in ESA must incorporate pressure sensors and limiters to prevent exceeding the catheter's rated burst pressure per FDA 510K standards and manufacturer safety protocols. Automatic cutoff with alarms ensures patient and equipment safety. Pre-programmed protocols aid efficiency, but pressure control ensures catheter and vessel integrity. Question 10. With respect to patient care, which of the following most directly supports the goal of reducing post-procedural hematoma formation at the vascular access site? A. Prolonged anticoagulation therapy. B. Manual compression with appropriate timing. C. Immediate ambulation post-procedure. D. Increasing saline flush post-access. Answer. Correct answer. B. Manual compression with appropriate timing. Explanation. Following catheter removal, manual compression is the standard of care for hemostasis. ASRT post-procedural care guidelines emphasize compression for at least 1.15 minutes or longer in anticoagulated patients. Immediate ambulation or inadequate pressure increases hematoma and bleeding risks. Question 11. A 45-year-old male patient undergoing an angiographic procedure develops an allergic reaction to the contrast medium. He begins to experience itching and shortness of breath. What is the most appropriate first course of action? A. Immediately administer an antihistamine and continue with the procedure. B. Stop the procedure and notify the physician while preparing for emergency intervention. C. Continue with the procedure and monitor vital signs for any worsening symptoms. D. Inject a dose of corticosteroids and continue with the angiogram. Answer. Correct answer. B. Stop the procedure and notify the physician while preparing for emergency intervention. Explanation. In the event of an allergic reaction, especially with symptoms like shortness of breath and itching, the procedure should be halted immediately. Emergency protocols as outlined by the ASRT and CertMedbry guidelines suggest notifying the physician as severe reactions can progress to anaphylaxis. Antihistamines and corticosteroids are commonly used for mild reactions, but immediate action is critical for life-threatening scenarios. Question 12. MS Patel, a 72-year-old patient, is scheduled for an angioplasty procedure. The fluoroscopy unit she will be using has recently undergone maintenance. Which of the following is the most critical step for ensuring image quality during the procedure? A. Adjusting the KVP and settings based on the patient's body haptics. B. Verifying that the collimator is set to the appropriate size for the procedure. C. Performing a pre-procedure test exposure to ensure detector calibration. D. Increasing the pulse rate of the fluoroscopy to reduce patient exposure. Answer. Correct answer. C. Performing a pre-procedure test exposure to ensure detector calibration. Explanation. A pre-procedure test exposure is essential to confirm the calibration of the fluoroscopy unit, especially after maintenance. This ensures the image quality is consistent and helps minimize radiation exposure. OPAM guidelines and FDA regulations emphasize the importance of periodic testing and calibration to ensure accurate image representation during fluoroscopic procedures. Question 13. Technologist notices an issue with the fluoroscopic image during a procedure with streak artifacts visible across the screen. Which of the following is the most likely cause of these artifacts? A. The anti-scatter grid is improperly aligned or malfunctioning. B. The patient has a metallic implant causing beam attenuation. C. The contrast media is incorrectly administered leading to uneven distribution. D. The fluoroscopic tube is incorrectly positioned relative to the patient. Answer. Correct answer A. The anti-scatter grid is improperly aligned or malfunctioning. Explanation. Streak artifacts are often caused by misalignment of the anti-scatter grid or grid malfunction. The grid helps remove scattered radiation, but if it's not properly aligned, it can produce striped or streaked images, according to OPAM Report Note 93. Proper grid alignment is essential for reducing scatter and maintaining image quality. Question 14. During a complex coronary intervention, the physician notices an occlusion in A distal vessel that is difficult to navigate with the standard catheter. Which technique should be considered to improve catheter maneuverability and avoid complications? A. Use a larger catheter size to push the obstruction out of the way. B. Introduce a hydrophilic guide wire to aid in navigating the vessel. C. Apply more contrast media to enhance visibility and guide the catheter. D. Use a balloon to dilate the vessel and then insert the catheter. Answer. Correct answer. B. Introduce a hydrophilic guide wire to aid in navigating the vessel. Explanation. A hydrophilic guide wire can improve catheter maneuverability in tortuous or difficult to reach vessels. These wires reduce friction and make navigation easier, especially in complex coronary or peripheral interventions. Using a larger catheter could damage the vessel, and balloon dilation should be done only after careful assessment of the occlusion type. Question 15. 56-year-old patient is undergoing an intravenous ablation procedure. The physician requests the use of laser energy to treat the varicose veins. What is the most important safety consideration when using laser energy in this procedure? A. Ensuring that the patient is properly sedated to avoid involuntary movements. B. Verifying that the laser energy settings are appropriately adjusted for the vessel size. C. Keeping the laser device in continuous mode to minimize treatment time. D. Wearing appropriate protective eyewear to shield from inadvertent laser exposure. Answer. Correct answer. D. Wearing appropriate protective eyewear to shield from inadvertent laser exposure. Explanation. Laser safety is paramount in procedures like intravenous ablation, where inadvertent exposure to the laser can cause severe eye injury. Protective eyewear for all personnel in the procedure room is mandatory as part of laser safety standards ANSI 0.1. Additionally, proper laser settings are important, but eye protection takes priority to the potential hazards. Question 16. In evaluating a peripheral angiogram, the radiologist notices motion artifacts caused by the patient's breathing during the procedure. What modification to the imaging technique is most likely to minimize this artifact? A. Increase the exposure time to capture more image data in one cycle. B. Request the patient to hold their breath for the duration of the procedure. C. Use a higher dose of contrast medium to enhance the image clarity. D. Reduce the KVP to minimize radiation exposure during imaging. Answer. Correct answer. B. Request the patient to hold their breath for the duration of the procedure. Explanation. Motion artifacts are typically caused by patient movement, including breathing. The simplest solution is to ask the patient to hold their breath during imaging to eliminate this motion. Increasing exposure time may lead to higher radiation doses, and reducing KVP can compromise image quality. Question 17. During a cerebral angiogram, the fluoroscopic imaging system starts to display a distorted image of the vessels. Which factor is most likely responsible for this distortion? A. A misalignment of the image intensifier. B. A failure in the contrast injector pump. C. Incorrect catheter placement in the vessel. D. A malfunction in the imaging software. Answer. Correct answer. A. A misalignment of the image intensifier. Explanation. Distorted images in fluoroscopy are often caused by misalignment of the image intensifier relative to the patient or the X-ray tube. This can cause artifacts or warping of the image, leading to diagnostic challenges. OPAM standards and FDA regulations require proper alignment of these components to ensure optimal image quality. Question 18. A 65-year-old male patient undergoing a coronary angiogram reports experiencing dizziness and nausea during the procedure. What is the most likely cause of these symptoms? A. A contrast media-induced allergic reaction. B. An inadequate amount of contrast used during the angiogram. C. A vasovagal reaction to the invasive procedure. D. Overexposure to radiation during the imaging process. Answer. Correct answer. C. A vasovagal reaction to the invasive procedure. Explanation. Vasovagal reactions are common in response to invasive procedures like angiograms. Symptoms such as dizziness and nausea often occur due to a sudden drop in blood pressure. Managing vasovagal responses typically involves elevating the patient's legs and monitoring vital signs. Allergic reactions to contrast can cause more severe symptoms, including shortness of breath. Question 19. technologist is preparing for a lower extremity angioplasty. Which of the following will most effectively minimize patient exposure during the procedure while maintaining image quality? A. Increasing the exposure time to improve image resolution. B. Using the lowest possible setting while maintaining adequate image quality. C. Adjusting the collimator to focus on the region of interest and exclude extraneous anatomy. D. Applying the higher dose of contrast media to improve visualization. Answer. Correct answer. C. Adjusting the collimator to focus on the region of interest and exclude extraneous anatomy. Explanation. Collimation reduces unnecessary radiation exposure by limiting the X-ray beam to the region of interest. This approach follows ALARA guidelines and maintains image quality while reducing dose. Increasing exposure time or contrast dose would unnecessarily elevate radiation, and the setting should always be balanced for quality and safety. Question 20. During a carotid artery intervention, the technologist notices that the digital subtraction angiography DSA image has a noticeable blur. What should the technologist check first to address the issue? A. The patient's respiration and motion to ensure proper breathing control. B. The angle of the C-arm to ensure optimal fluoroscopic imaging. C. The fluoroscopic exposure time settings to reduce the blurring effect. D. The contrast injector pump speed to ensure proper contrast flow. Answer. Correct answer A. The patient's respiration and motion to ensure proper breathing control. Explanation. Motion artifacts are a common cause of blur in DSA images. Since respiratory motion is frequent during these procedures, ensuring the patient holds their breath can reduce motion blur. While other adjustments may also help, patient movement is the most likely cause of the issue. Question 21. During a routine interventional radiology procedure, a technologist notices that the fluoroscopic images are too dark. What is the most appropriate first action to address this issue? A. Increase the setting to enhance image brightness. B. Decrease the exposure time to avoid overexposure. C. Adjust the KVP setting to improve contrast. D. Verify the collimation and adjust if necessary to exclude unnecessary anatomy. Answer. Correct answer. C. Just the KVP setting to improve contrast. Explanation. The KVP setting directly affects the contrast and brightness of the image. If the image is too dark, the technologist should adjust the KVP to ensure better visibility of the structures. Increasing can affect the overall dose, and adjusting the collimation ensures that only the area of interest is captured but may not resolve image brightness issues. Question 22. A 58-year-old male patient undergoing a fluoroscopic guided procedure begins experiencing sudden chest pain and sweating. What should be the first action taken by the healthcare team? A. Continue the procedure and monitor vital signs for any changes. B. Stop the procedure immediately and assess the patient's condition. C. Administer a dose of morphine to manage the pain. D. Increase the fluoroscopic exposure time to gather more information. Answer. Correct answer. B. Stop the procedure immediately and assess the patient's condition. Explanation. Any sudden onset of chest pain and sweating during a procedure could indicate a serious condition like a cardiac event. The procedure should be halted immediately, and the healthcare team should prioritize patient assessment. Morphine may be administered later, but stopping the procedure comes first. Question 23. During an angioplasty procedure, the physician encounters difficulty advancing the catheter due to vessel tortuosity. Which of the following techniques is most likely to aid in overcoming this challenge? A. Increase the contrast media injection rate to better visualize the path. B. Use a supportive guide catheter to help steer the catheter through the tortuous vessel. C. Increase the exposure time to improve visualization of the vessel. D. Use a larger catheter to push through the tortuosity. Answer. Correct answer. B. Use a supportive guide catheter to help steer the catheter through the tortuous vessel. Explanation. When faced with vessel tortuosity, using a supportive guide catheter is essential for better steering and support of the diagnostic catheter. Increasing the contrast injection rate or using a larger catheter can lead to complications or worsening the situation. Prolonging exposure time also unnecessarily increases radiation risks with addressing the root cause. Question 24. 50-year-old female patient presents for A uterine artery embolization procedure. The radiologist notices some interference in the image due to a possible metallic implant. Which action should the technologist take next? A. Adjust the fluoroscopy machine's pulse rate to reduce the interference. B. Ask the patient to change their position and re-image to eliminate the interference. C. Use a higher contrast dose to overcome the interference. D. Use the collimator to focus on the region of interest while minimizing interference. Answer. Correct answer. D. Use the collimator to focus on the region of interest while minimizing interference. Explanation. Metallic implants often cause interference with imaging, resulting in artifacts. Collimating the image to the region of interest can help reduce the impact of the interference and maintain image quality. Changing the patient's position or adjusting the pulse rate might not effectively resolve the issue. Question 25. A patient undergoing a cardiac catheterization reports feeling dizzy and lightheaded. What is the most likely cause of these symptoms during the procedure? A. A reaction to the contrast medium. B. Overexposure to radiation during the procedure. C. A vasovagal response to the invasive nature of the procedure. D. Hypoglycemia from fasting prior to the procedure. Answer. Correct answer. C. A vasovagal response to the invasive nature of the procedure. Explanation. Vasovagal responses are common during invasive procedures like cardiac catheterization. Symptoms such as dizziness and lightheadedness are often triggered by stress or anxiety related to the procedure, while other causes like contrast reactions could also present with similar symptoms. A vasovagal response is most common. Question 26. A technologist is conducting a fluoroscopic guided procedure and notices an image artifact resembling a grid pattern. What is the likely cause of this artifact? A. A malfunctioning image intensifier. B. Misalignment or malfunction of the anti-scatter grid. C. Incorrectly placed patient positioning. D. Overexposure to radiation during the imaging process. Answer. Correct answer. B. Misalignment or malfunction of the anti-scatter grid. Explanation. A grid pattern artifact is typically caused by misalignment or malfunction of the anti-scatter grid, which is designed to remove scatter radiation. If the grid is not aligned correctly, it produces visible lines or a grid pattern in the image. Overexposure may lead to other image issues, but it doesn't cause grid pattern artifact. Question 27. During a fluoroscopic procedure, the physician requests the use of a rotational angiogram to assess a vascular anomaly. Which of the following is the most critical consideration when performing this technique? A. Ensuring the fluoroscopy machine is calibrated to the highest possible output. B. Minimizing patient movement to avoid image distortion. C. Adjusting the angle of the C-arm and tube to allow full 360-degree rotation. D. Decreasing the dose of contrast medium to prevent inverse reactions. Answer. Correct answer. C. Adjusting the angle of the C-arm and tube to allow full 360-degree rotation. Explanation. A rotational angiogram involves rotating the C-arm and fluoroscopy tube to capture multiple projections around the vascular anomaly. This is critical for obtaining comprehensive 3D views. Adjusting the contrast dose or fluoroscopy output could affect image quality but is not the key focus in this specific scenario. Question 20. During a spinal angiogram, the physician orders the injection of a contrast medium, but the technologist notices that the image appears to be overexposed. What should be the technologist's first response? A. Increase the contrast dose to improve image clarity. B. Reduce the exposure time to prevent overexposure. C. Adjust the collimation to ensure the field of view is correct. D. Decrease the KVP setting to improve image contrast. Answer. Correct answer. B. Reduce the exposure time to prevent overexposure. Of explanation. In the case of overexposure, the first step should be to reduce the exposure time. Overexposure can cause loss of image detail and may unnecessarily increase radiation dose. Adjusting the KVP or collimating the field can help, but reducing the exposure time is the most direct response. Question 29. A 45-year-old patient is undergoing a pulmonary angiogram for a suspected pulmonary embolism. The physician is concerned about the risk of contrast-induced nephropathy. What precautions should the healthcare team take to minimize this risk? Administer a prophylactic dose of corticosteroids before the procedure. B. Ensure the patient is well hydrated before the procedure to help flush out the contrast. C. Decrease the exposure time to reduce the overall radiation dose. D. Use a low osmolar contrast agent with a reduced iodine concentration. Answer. Correct answer. B. Ensure the patient is well hydrated before the procedure to help flush out the contrast. Explanation. Hydration is key to minimizing the risk of contrast-induced nephropathy. Sin. Ensuring the patient is adequately hydrated before and after the procedure helps flush the contrast out of the kidneys. Low osmolar contrast is also helpful, but hydration plays a more critical role in preventing sin. Question 30. During a diagnostic angiogram, a technologist notices that the patient is experiencing a reaction to the contrast agent, exhibiting symptoms of mild itching. What should the technologist do first? A. Administer an antihistamine to alleviate the symptoms. B. Notify the physician and monitor the patient closely for further reactions. C. Continue the procedure and observe the patient's condition. D. Stop the procedure immediately and evacuate the room. Answer. Correct answer. B. Notify the physician and monitor the patient closely for further reactions. Explanation. Mild reactions to contrast agents such as itching require close monitoring. Notifying the physician and keeping an eye on the patient's condition is crucial. In some cases, antihistamines may be administered, but immediate cessation of the procedure is not necessary unless symptoms escalate.